My name is Kolade Ajayi. I'm going to be presenting the case study 3, which is the case about Gregory Baker, and the diagnosis is schizophrenia. The objectives include definition, summary, diagnosis, rationale, treatment, evidence, conclusion, and references. The definition according to Patel, Sherian, Gohill, and Atkinson. Definition of schizophrenia. Schizophrenia is a complex, chronic mental health disorder characterized by an array of symptoms, including delusion, hallucinations, disorganized speech or behavior, and impaired cognitive ability. Summary of the case. Gregory Baker is an African-American 20-year-old male patient who was suspended a couple of months previously for lack of attendance and was brought to the ER of the school he attended due to bizarre behavior in class. He has had a notable increase in nullity in his behavior, such as the fact that he spends most of the time staring at ceiling. He quits seeing friends and rarely speaks with family members, even though he lived with a lot of them. In addition to some self-harm behavior, he has been preoccupied with a female friend insisting that they were engaged. Upon admission, patients tested negative for toxicology results. He was generally noted to have paranoid grandiose and romantic delusions and internally preoccupied, though he denied hallucination. Both mother and maternal grandmother had psychiatric disorder. Originally declined psychiatric evaluation, he eventually consented to sign himself into a psychiatric unit. The diagnosis from the observable data, it's schizophrenia, first episode, currently in acute episode. Rationale. The rationale, Baker is undergoing a significant decline from the case. He is obviously having paranoid grandiose, romantic delusion, and hallucinations. The symptoms have persisted and got worse over 1 year. He is also found to be eliciting negative symptoms such as lying in bed all day, which is a term called avolition. The history shows no substance abuse is involved. So if all of these are in place, and according to DSM-5 diagnosis, which is found in the American Psychiatric Association book, it is schizophrenia. The treatment. The treatment are both pharmacology and non-pharmacology. According to the American Psychiatric Association, second generation, which is atypical antipsychotics, are the agents of choice for first-line treatment of schizophrenia. Medication includes Abilify, Safris, Latuda. Clozapine is the most effective antipsychotic in terms of managing treatment-resistant schizophrenia. Augmentation could be needed in case of patients that are considered to not respond to monotherapy. Non-pharmacology that are considered are mostly psychotherapy, could be cognitive behavior psychotherapy, which is cognitive behavioral therapy, compliance therapy, could be individual therapy. It could be group therapy. Evidence one. Evidence one. This is a systemic review meta-analysis uh, designed in determining whether clonazepam should be used as first-line or second-line treatment in treatment-resistant schizophrenia spectrum disorder patients. The study was conducted by Owishen and others in 2018. The result shows that clonazepam is more effective than other antipsychotics when used as first or second line treatment compared to miscellaneous groups of antipsychotics. Evidence 2 is a case report research whose purpose is to determine the effect of the use of either clonazepam or electroconvulsive therapy in acute phase and maintenance treatment of schizophrenia in adults with intellectual disability. The study was done by Dishaka, Bloomberger, and Das Kalakis in 2018. And the result shows better result was found when clonazepam is combined with electroconvulsive therapy in the treatment of resistant schizophrenia and catatonia. Evidence 3 is a meta-analysis with the purpose of balancing psychotropic medication choice as first-line treatment for patients with schizophrenia against relative risk of side effects. This was conducted by Smith, Leuch, and Davids in 2019. The result shows that antipsychotics are not the same in terms of severity of their side effects and efficiency. With clonazepam, it was found to have a best efficiency when compared with placebo in terms of the side effects and their efficiency. Evidence 4. This is an historic patient cohort sample of 2,837 patients to determine the protective effect of clozapine on mortality in patients with treatment-resistant schizophrenia from January 2008 through January 2016. Here, 6 other common antipsychotics were identified in the study, namely amisulpride, ariprazole, haloperidol, olanzapine, risperidol, quetiapine. The research was carried out by Cho and others in 2019, and it was concluded that clozapine reduces the risk of mortality in patients. Evidence 5. The purpose of this was to study the adjunctive effect of adding minocycline to clozapine in treatment of refractory schizophrenia following the fact that 60% of patients fail to respond adequately to monotherapy. And this was done over 10 weeks, carried out by Waring and others in 2018. The result shows that superiority was found in outcome for patients on clozapine with minocycline group combined. Evidence 6. Evidence 6. The purpose of the research was to evaluate the relationship between metabolic syndrome, severity of psychiatric symptoms, living arrangements, health behavior, antipsychotic medication in outpatient patients with schizophrenia. The study was done by Escalinen and others in 2015, performing comprehensive health on 276 patients. The result shows that the use of clozapine doubled the risk of metabolic syndrome, but the positive was that um, self-reported physical activity decreased the risks significantly. So this just confirms that with the use of lifestyle changes such as physical activity, a patient could have the possibility of metabolic syndrome uh, reduced. In conclusion, Gregory's diagnosis is schizophrenia, which is first episode currently in acute episode. The rationale is based on DSM diagnosis with patients having both positive and negative symptoms. The positive symptoms include delusion and hallucinations. The negative symptoms include lying in bed all day, which is known as avolition. The recommended treatments are both pharmacology, which is the use of atypical antipsychotics, and non-pharmacology, which is psychotherapy. Augmentation therapy or combination therapy may be considered in case of treatment failure using monotherapy by itself. Thank you for listening. Have a great day.